And I can see that we're basically out of time. I did have a few discussion questions, and I'm happy to stay a little longer if people have other questions or want to talk about these prompts. So I will stop there.
Excellent.
Thank you.
And virtual clapping.
Yeah.
So I dropped a link to a Google Doc in the chat. I am copying things from the chat over and tons of ideas. And I want to thank Dr. Van Meter for agreeing to do the talk. I want to thank HCAPS and also the University of North Carolina Student Senate for funding the talk, supporting the project, the speaker series. And a shout out to Taylor Steele and Caroline Vincent at the UNC HCAPS chapter for actually writing the grant and getting it funded. And Viraj Garg for the help with the social media and getting the word out. There are a lot of original gangsters on the Zoom tonight. So we have Hannah Kim in the house, and Emma Chaplin, and as soon as we got going, I was like, oh snap, I wanted to acknowledge the HCAPS connections, and Dr. Van Meter has been a wonderful mentor and very engaged with HCAPS since the beginning. So not surprisingly, I forgot, and you already had it written down in the slide. So that was outstanding. So people can turn the cameras on, and we'll in a great HCAPS tradition, welcome to the after party.
Hey, thank you so much for presenting. This was really excellent. I have a lot of questions, but I'll hold them for now.
Thanks.
I have one question really quickly, and that is specifically on, has there been any research yet done on who's more likely to be cautious with sharing their data? I know that one of the questions you have listed is like, will people be opening to sharing online data with clinicians? And I think the answer is probably like some. But I think especially thinking of kids and children, when we're doing research with them, it's like largely going to be their parents making that decision. I feel like most of them are more likely to be a little bit like, yeah, whatever, it's fine. Everyone has my technology anyways, whereas their parents might be more cautious. And so I was just wondering if any research has been done specifically on people that are more and or less likely to like be willing to share that data, or if any trends have been noticed yet.
I'm not sure if they've done research on that. I can speak sort of anecdotally to my experience with that. And with the digital archive project in particular, I think there's definitely an age effect. So I think we were recruiting people up to the age of like 38 or something. I don't remember exactly, but younger people definitely were more comfortable and more likely to consent to participate in the study. I think that, you know, people who have had social media and an online presence sort of always are more comfortable with the idea that that stuff is just out there and it's not a big deal. With my digital phenotype study, the phone data, parents typically do have more concerns than the kids do, I would say. But we haven't had too many people decline to participate. I think because we're not really collecting the content of what they're doing, it's more about how they're interacting with the phone. But I think that it's also a little bit different if it's a researcher versus your own clinician. So I think that one of the other questions I put was something about, you know, if it would modify behavior. As a therapist, I know that people aren't always 100% honest with me, you know, like, oh, did you do your homework? Yeah, of course I did, but I forgot it or whatever. And if your therapist has direct access to your Facebook page or your Instagram or whatever. I don't know, even if you want to be able to tell your therapist everything, you don't necessarily want them to know everything if you didn't directly tell them that. So I think it's different if it's like a person you know is looking at your data versus it's going into a research study. So I think the actual clinical utility of this, we don't know yet.
If you were a betting person, what do you bet would be the most helpful in predicting changes and how the person is doing? Would it be an app rating their mood? Would it be the geo-tracking and actigraphy stuff? Would it be the searches? Ben Goldstein has a paper where they're actually looking at, so he's big on biomarkers, and they were looking at changes in C-reactive protein and interleukin 6 and 10, and the C-reactive protein levels predicted who was going to get worse 2 weeks later. Not a huge effect, but so like do you think, so if you were betting biology or the geotagging or the passive stuff or an app, what would you bet on?
Well, I'm going to cheat a little bit, and I'm going to say sleep, which you can you can collect through an app, but it's biological. I mean, Ben's research is cool, but you have to get a blood draw. So yeah, I think that's going to be a limiting factor for him. And I think the Google search and the surveys, when people are really getting worse, they just don't do them. And so that's information, but it could be that you're on vacation, or it could be that you're depressed or manic or whatever. So
with the apps and the sorts of tracking that you're doing the research with, it's interesting to me to think about HCAPS and Wiki as a way of actually having it not take 17 years to get from the good stuff to something that actually would change care.
mm-hmm.
Do you have any thoughts about sort of what could HCAPS, sort of recognizing you don't want to oversell and push stuff that isn't ready yet, but do you see ways that it might be possible to, if we're comfortable working online already, are there ways that we could speed the process, the D&I?
Potentially. So some apps are open source, and they, post the code and people can use it, modify it. And I think that's potentially a good model, but it requires knowledge of programming and also money to pay someone to program it. I'm working with some people from Beth Israel right now, and they have an open source app, but it's requiring like a huge team of people to get it to work for us. So I think in theory, providing something like that could be helpful. And, the good thing is that as the years go by, more and more people are going to be proficient in programming, and they're going to become more ways of, like an interface that can translate what you want to do into the programming language, so it won't require computer scientists necessarily. But I think that's a limitation. I think what would be good now is to try to incentivize people in industry, in tech, to help, because they move very quickly. I'm on advisory board for a mental health related app. And it's cool to see like how quickly they iterate and test things, and they have the resources to deal with the operating system updates and things like that I think most people in academia just don't, or clinicians or whatever.
How are they monetizing it?
That's not totally clear yet. They're trying to build something that people will like and that will be beneficial. But they haven't, I think it's probably going to be like one of those freemium models where you pay for extras, rather than like an Instagram model where you're getting advertisements and things like that.
Or I guess they could sell your data like Google is doing. What's the expression? If you're not paying for it, you're the product.
Yeah, exactly. Mm-hmm.
I have a question. In the beginning, you mentioned like the basically access to care gap right now. You mentioned also that peer support is really beneficial in reducing emotional stress. Has there been any research on one-sided remote peer support? Like, in a like a better way to put it, what I mean is that I used to work at a YouTube channel, and they produced a lot of videos with kids and teens as themselves, where they were talking about pop culture stuff, and sometimes got into more serious matters, talking about stuff like coming out for the first time, or their troubles with mental health, depression, suicide. And we received a lot of good comments, a lot of like beneficial comments from people who were watching it, but that was like anecdotal. I don't really know how much that impacted people.
Yeah, I don't know of anything that is looking at that specifically, but I know that these like testimonials sort of have been incorporated into different psychosocial interventions. And I think it can be really powerful to have something like that. I wrote a grant that didn't get funded, but one of the things that was in it was having testimonials like this from like peers about different mental health challenges that they had overcome, but then also having the participant create their own testimonial, which I think can be a good way of recognizing your own strengths and then feeling like you're also contributing and helping other people. So I can imagine something like that. It's making me think now even of like pen pals, if you've ever had a pen pal where you like, or a chain letter where you like send one and then someone else sends it, and so you could like make your own testimonial, send it to someone, and then it kind of keeps going. I think something like that would be cool.
Yeah, like a pay it forward thing.
Yeah, exactly. I don't think it necessarily has to be an interaction, like where I'm talking to you, you're talking back to me. I think that you can learn from and feel supported just by hearing other people's stories.
Right. Seeing someone like disclose that sort of information is empowering. I can see that.
Are people using Twitter or Insta to do that sort of thing? As I was with Hannah on the Zoom, I was like, with the testimonial or the really short story.
Yeah, they're doing that through Twitter. Like they do Twitter chains where, and if you can even do it where you tag somebody, or on Instagram you can like elect somebody else to like tag them basically to share their thing. So.
Yeah, I think also we're trying to make this shift, I think through the pandemic, of having social media be more transparent and not just this facade of like everything's okay, because everyone's like not okay right now. So I think people are trying to make an effort. I've seen in like blog posts type style and like video reels they have now. So like people are doing video blogs of their kind of like day-to-day experience and trying to be more just open and honest about like their struggles with mental health and just like in general.
Yeah, that might be why we saw that at least the depression go down lower and lower as the people who were more active on social media were going through the pandemic, is that they were more um, genuine and comfortable with opening up about being, I guess, uncomfortable during this.
Yeah. Honestly, not to give TikTok too much credit, but I feel like my engagement in TikTok boosts my mood. I don't know about any other young adults and teens, but I think it was very uplifting. But again, like it learns you. So like if you're really sad and down in the dumps, like it might give you content that makes you even more sad. But then it might be able to revive you when you're kind of on that edge and still getting that happy content. I'm not like super familiar with their algorithms, but
Well, I think too, like the culture of the product matters a lot. So the culture of Instagram is that you post like this perfect version of yourself. And so when you're looking at everyone else's perfect version, you feel like crap. Whereas TikTok is more like fun and silly, or most of it is at least. And so I think you're right that that can have a mood boosting effect. And it's not necessarily about like being perfect all the time.
Have you seen Fuck Up Nights?
Mhm.
It's sort of deliberately thinking about the culture. They're billing themselves as the anti TED Talk. Let's be honest and talk about our spectacular failures and how that worked out.
Yep.
I had a question in regards to more of like the I guess like more so. Okay, so I'll just ask it. So when you're like you talked about earlier, where how youth can't always recall you know the like past, how they were doing in the past and whatnot, and you talked about how you were collecting this information and whatnot so that there would be more information for clinicians to make decisions upon. Would it, like for instance, I know when somebody usually comes in, the clinician will ask how they were feeling since like the last time that they saw them, and ask them about like their sleep, mood, and other like eating and things of that nature. But do you think these apps, or even maybe through Qualtrics, if clinicians were able to send maybe like daily checkers, or question, like a shortened version of that for them to answer every day, that would give the clinician a more accurate representation on how that like child or like teenager had been doing since the last time they saw them, and then that could inform their treatment or their like session for that day? Or do you think it's just too complex to actually try to not only collect that data, but then for the clinician to view it and then base their session on it?
I think it's a great idea. I know I can think of two studies off the top of my head where they showed that sort of the like inter-session variability and suicidality in particular changed a lot, and sort of emphasizing the importance of assessing people between sessions, because things do change, but also with something like suicidal thoughts, or even depressive symptoms or anxiety, like they might not want to disclose it to you when they're there in the session, or they might feel better when they're there, they're like have someone to talk to, they feel supported, So it might not always be like the most representative
Right.
data that you're getting. So I think definitely asking for information between the times you see people could be valuable.
Yeah, instead of like asking them to remember over the past 4 weeks or 2 weeks or whatever.
Yeah, I mean, in the digital phenotype study, I thought talking to people every month would be a good way of getting like pretty fine detail. And I think more than that would be too burdensome, but even 4 weeks, it's like pretty hard for people to remember sometimes what happens. So
that's actually where my like question originated from, when you were talking about how the anxiety and the I think you said like it was PHQ-9 you were giving like every month. I can just see just based on, you know, personal experiences and my friends' personal experiences with coronavirus, each week it just is like a bad week or a good week just based on a lot of different, you know, external factors or what's going on. And so, you know, it just depends on what week you catch that person at, kind of thing.
yep. And I think what you want is to see their weeks over time, because if you're having a bad day, that doesn't mean you're not going to feel better tomorrow. So kind of seeing someone's trajectory, I think, is really helpful clinically.
Yeah. And then I think it is also helpful, I think, for targeting, okay, so I'm noticing like week 3, I'm seeing this, that, and the other, what was going on situationally, and then you can target maybe certain problems, and then, you know, how to mitigate that next time they're in that situation again or whatnot. Better recall.
Definitely.
Natalie was asking whether you think that the assessment information gathering that you're talking about would move into the adaptive treatment. Sort of how easy or hard would it be to connect those?
I think that's the goal. Doing sort of like just-in-time interventions, particularly if someone endorsed suicidal thinking or something like that. Yeah, I think that's definitely the goal. And there are some studies that do kind of a basic version of that. But I don't think there's been a lot that is really like dynamic and kind of shifting all the time to give you what you need. But I hope we'll get there.
Do you see machine learning or another process like that as a potential solution, a way to help people find what level of resource they need when they need it, depending on their level of depressive symptoms or other mood disorders?
Yeah, I think it would have to be something like that, probably, or, you know, that would be the most sophisticated version of it. We could make something simpler. But, you know, like these social medias that kind of give you like what you're asking for, so to speak, like it could be something like opposite of that. Like I'm thinking Facebook did this study a while ago where they manipulated the emotional content of what people were seeing. So whether it was like a positively valenced or negatively valenced post, and they found that it affected the emotion of the person who is seeing that. And so you could see that if you were assessing people through surveys, through digital phenotyping, and you suspected that they were depressed, that you could have, you know, their social media algorithm change to show them more positive content. You know, like if we think about like a master of the universe who's sort of like controlling all of your data, that could totally happen. So especially like if you're on an Android phone, right? So you like all your Google stuff is
That and YouTube does a pretty
connected.
good job of doing that, because now when I open up YouTube, like the suggested videos are all things I want to see, like Conan videos and cat videos. So but I can imagine somebody like searching stuff that's not like, maybe if there's something like depressed song list or like top 10 best depressed songs or something, then I could see that YouTube trend would not be helpful.
Yeah.
Right, but I think in this idea, it's not even like what you think you want. It's like what you need based on what we're inferring
Yeah,
about your
yeah.
mood from your
Maybe,
activity.
maybe if there was like a setting for, you know, suggesting like, okay, there, even though I'm putting this input in, can you give me this output kind of thing?
That is so fascinating. I know, like in my experience, Google and then YouTube, they were like reporting, at least when I was working at the YouTube channel, that they do not manipulate the algorithm at all. There's no way to manipulate the algorithm. And I guess that sort of maybe speaks to like this sort of PR perhaps of saying that they're hands off and they're not controlling what people see. But if it could be used to the benefit of people to help them, especially when they're in these emergency situations, that is, the implications are really, really fascinating.
Yeah, because
Mhm.
I know that YouTube does do that, because after like I'll go to the suggested page and it'll have a like a little thing at the bottom, like was this suggested video good or bad, and then I can pick the smiley face. Basically it's like a Likert scale, but smiley faces on whether this was a good suggestion for what I want to see or not. And then even after, sometimes I watch a video, it'll say stuff like, what kind of videos do you want to see or something, and then I can click it as a survey.
Mhm.
I was just thinking about like one of the barriers to doing like technology research, specifically social media research with adolescents, is like how much faster social media and adolescents change versus like how fast academia can work. So like I did a bit of research in Princeton's peer relations lab, and we were trying to look at like adolescents finstas. But we were like, by the time that we are trying to look at finstas, like will finstas still be a thing that are relevant for teenagers like in the next 2 years? Or same things with like how fast Snapchat was a thing and then wasn't, or Vine was a thing and then wasn't, or how people, I feel like when I was in high school, were on Tumblr all the time, and like the anonymity and like how all of these different apps can affect people differently. Or like Yik Yak was this like anonymous college app where people would post about other people they were at college with. And just kind of how that's crazy. But I was wondering about how you all kind of think about that framework. Like I feel like Facebook's more stable, but most teenagers aren't on Facebook anymore. And like how you think about and or address that kind of issue of how slow academia and research moves compared to like how quick social media trends are, specifically with like younger populations.
Facebook
Yeah,
is
I
now
don't.
50-something dads with Fitbits.
Mhm.
7% of kids dress like dads is what I got from that study.
Yeah, exactly. Maybe dressed by dads. I don't know. Um, I don't think people take it into account enough, honestly. Like the Facebook studies that I mentioned, um, my colleague who's sort of in charge of those is interested in first episode psychosis. That's like his main patient population. And I don't think Facebook is relevant, really. So you can learn things, I think, about the type of content. So people are still going to use words and pictures, presumably. It might just be in a different medium. But yeah, I don't think the actual social media site, if you're sort of tied to that, I think you're going to be out of date pretty quickly.
Yeah. Cool.
I think also like what you were mentioning, Anna, about pairing more and collaborating with like tech and different like computer science type companies is like the benefit is they have these people that like trend forecast and pay a lot of people to figure out like what's the new and latest thing, or like how long is this going to be like popular. And obviously, like just like the weatherman's wrong, like at least that's that first line of, is it even worth like making and trying to code for this specific social media if like we really don't think it's going to be around that long.
Right. Yeah, I think that's a good point. And I think there is an opportunity potentially because a lot of the social media companies kind of have a bad reputation, or there's a sense at least that like social media is kind of bad for people. And so if they were to do something to try to promote mental health or have some products that are mental health focused, I think that that could serve them and the community potentially. So hopefully we'll see something like that.
But it's also, I'm interested in the ethical implications of that too, because the people that would be employed, they would be employed by Facebook and Twitter, and so arguably you wonder like who are they beholden to when it comes to like morally compromising decisions. Like they have the license from the APA, they have been trained and qualified, but then they're also paid by Facebook and these tech companies who have these reputations for a reason. So
yeah,
it's oh man. Yeah.
Yeah, no, it's true. And you'd want to see like a firewall between the mental health product and the like basically advertising company that Facebook is, but it seems unlikely.
Partnership with HCAPS, on the other hand, would be great. Huh?
Yeah, definitely.
Good plug.
Nicely done.
I really do think that if it would be good for the assessment center to have more, I guess, like not ecological data, but more like progress for day to day, how they're doing day to day, maybe even like, and have it set up like, I'm just thinking about the study I did with you with the boomerang and whatnot. If there was a easy, because that was so difficult to set it up. I know that AppToto is great, but you have to pay for that. And so it's just like Boomerang, but less work. And it'll just send those surveys out and reminders to do them each day. But it would be a burden on the clinician to then take all of the results or PDF printouts from each of those surveys and then, adapt their session to what it's saying.
Yeah, and I think that's a topic that we've had a lot of conversations about is you can make inferences from the data, but then what is a clinician going to do with that? Does it actually help them in their session? Is it, if I'm collecting Facebook data, constantly, just the volume of that isn't going to be something that a clinician's going to look at. So you have to be able to distill it in some way. And then, does it make really a difference? Is it something that they feel like can inform their clinical decisions? Because if not, then it's just sort of an intellectual exercise.
Yeah, because, and I think this is, I don't really know, and I don't know if this changes based on, what type of clinician you're seeing or just their style or whatnot, but, if they're on some type of like CBT plan where, okay, this session will do this session will do that, or are they basing their session on what that first intake questionnaire is about their week, and then or what that patient says that was bothering them that week or whatnot. And so I feel like it depends on the clinician and their treatment plans or styles.
Mm-hmm.
Really neat stuff in the Google Doc now too.
Excellent. I'll look forward to checking it out. So thank you all so much. This was like a cool discussion, and thanks for sticking around so long and listening.